Namaste all the viewers, subscribers and friends. Today again we have come up with a new topic to discuss and understand. Before we begin, we want to express our gratitude to all of you who have been supporting by watching our video, sharing our video. Please continue your support and share the same amongst your friends, relatives who are in need of the information. Our basic motto is to spread awareness about health, about preventive health, about well-being, and how we can manage diseases through natural healing solutions like acupuncture, yoga therapy, following a healthy nutritious diet habit. How can we follow a natural lifestyle? So these are our expertise, and that's how we want to create and spread the awareness. So the topic of discussion today is carpal tunnel syndrome. So what is carpal tunnel? It seems like we are talking about some tunnel rather than health and disease management. Carpal tunnel is like a passage that is in the front part of the wrist. Okay, this tunnel is found by the bones and the ligaments here, and through that tunnel there are a lot of tendons, nerves, vessels that pass through and supply the wrist, support the muscles of the wrist, support the bones of the wrist, and also provide circulation to the structures of the palm and the fingers. So this is called the carpal tunnel. It is named as carpal tunnel. So carpal tunnel syndrome is if there is any irritation, injury, or any sort of pressure that is constantly being put on this tunnel, it can irritate one of the main nerve that passes through this tunnel called the median nerve. So there is a nerve, median nerve, which passes through this, and if there is pressure or injury or some sort of irritation, then it can cause symptoms accordingly. Whenever there is a nerve that is being irritated or injured or compressed, the usual symptoms are numbness of the area that it supplies, tingling sensation or kind of pricking sensation, and also there is sometimes weakness of the muscle because nerve is not able to supply properly. So there can be weakness, the grip of the palm reduces, you cannot hold something or write something with comfort. So these are some of the main symptoms that you experience in carpal tunnel syndrome. So what can cause this irritation? Say you had a fall where you have put complete pressure on the wrist. You have had an accident or something that has injured the wrist, or if you are repetitively using your wrist and applying pressure, for example mouse, or if you're using your keyboard, or people who ride the bike a lot and who have to always keep this accelerated version of the wrist, so there is pressure here. So people who tend to use the wrist a lot or apply pressure on the wrist a lot tend to get carpal tunnel syndrome, apart from injuries and accidents. Along with this, there are certain risk factors. For example, if somebody is diabetic, they are prone to get neuropathy, nerve damage. So the risk factor for carpal tunnel increases if you are a diabetic, or if you're going through certain kidney disorders where fluid movement, fluid accumulation is high. And also if somebody is having thyroid diseases, again the risk increases. Basically it is a posture issue. So if you are into a profession or practice where you do not take care of your wrist posture and applying a lot of pressure, that is a big risk factor more than anything else. Okay, certain medications can also cause carpal tunnel syndrome. Certain surgeries can also lead to carpal tunnel syndrome if the median nerve is damaged in the tunnel. So all of these are the risk factors and the causative factors. Any inflammation that is happening within the body, it could be rheumatoid arthritis, inflammatory arthritis. So joint and the bones that are inflamed again can put some irritation and pressure on the nerve and can cause the carpal tunnel syndrome. How do we prevent carpal tunnel syndrome? Is first thing, take care of the posture so that you don't put constant pressure. If you are into a profession where you have to put pressure, you can take breaks and make sure that you do not put complete pressure or constant pressure. You exercise your wrist and hands. In fact, exercising the entire body is important, but in specific, if you are able to strengthen your arm and forearm muscles, your wrist joint, that can also help in preventing carpal tunnel syndrome, so that there is no stiffness of the joint, there is no obvious compression of the joint here, of the wrist joint and the tunnel. So these are some of the preventive aspects. And how do we manage if suppose we are going through carpal tunnel syndrome? First is recognizing the symptoms. Am I facing any numbness or tingling sensation in the palms? Is there any weakness, reduced grip in the palm? These are the symptoms that we have to recognize first. Is it aggravating, especially with cold exposure, cold wind, early morning, if you're riding your bike? Is there some sort of increase in the symptoms? All of these are something that we have to be aware of and observe, so that we recognize it. Once it is recognized, it needs to be managed. It can be managed by taking anti-inflammatory medications. When it is very severe, some people also go for surgical, when the pressure is put on the nerve, if surgically that pressure can be resolved, that is also possible if it is extreme condition. Otherwise, it can be very well managed with rest, with cold and hot, compress both. Cold to bring down the inflammation, heat to manage the pain and swelling if there is any. So your doctor is going to suggest how you should make this combination of cold and hot compress. Along with that, certain exercises that stretches and relaxes the tunnel here, that will also help in the management. But when the pain is very acute or the symptoms are very acute, you need some therapy that will help bring down the symptoms and help bring down the inflammation. There, acupuncture plays a very promising role. When acupuncture is done, or when acu needles or these fine needles are inserted into certain areas around the wrist to manage the pain, to bring down inflammation, to release the compression on the nerve, there is lot of changes that happen locally. What are the changes? Natural painkillers are released. There are anti-inflammatory neurochemicals that are released that bring down the inflammation of the nerve, and circulation to that area also improves. So muscular strength that was lost because of the nerve compression, circulation, everything can be improved with insertion of acu needles on the points. So when you go to a registered practitioner, licensed practitioner, they'll know where to insert the needles and help you with acupuncture. So acupuncture is very promising. With acupuncture, when your symptoms come down, when your symptoms are managed, you can then start with exercises, yoga therapy, that will help maintain the effect of acupuncture and prevent further recurrence of carpal tunnel syndrome. Okay, so this is how we can manage, prevent, recognize the symptoms, go for treatments when the symptoms are very acute, and therapies like acupuncture and yoga therapy under a licensed practitioner, so that you can very well manage your carpal tunnel syndrome and prevent secondary recurrences. With that, I'm hopeful that I've given you enough information about carpal tunnel syndrome and you have understood it. If need be, please visit our clinic if you are looking out for how to manage your carpal tunnel syndrome, or share it amongst your relatives and friends who are looking out for the same. With that, we end today's discussion. Thank you so much for your patient hearing.